So you're interested in optimizing your growth hormone, and you've heard the hype about these growth hormone peptides. Only thing is, it's kind of confusing. You have oral, you have injectable, you have MK, there's numbers, the words are confusing, and you've even heard that you can combine them. Well, today I want to go ahead and break down the different types, how maybe you can combine them, and how I use them in my clinical practice, or not, because some of them are not FDA approved. Now, we will break down the two different categories and how they even compare to actual growth hormone. And I think it's a good idea that we just chat briefly about growth hormone. Growth hormone, like other hormones like testosterone, decreases as we age, and it's very important for helping you to sleep better. It's really good for recovery, and it's good for your energy. So, as we age, our growth hormone and IGF-1 go down, and as it decreases, it really impacts our ability to recover. Now, there's some controversy with optimizing growth hormone and cancer. I'm going to leave that for another video. In my opinion, it really depends on the situation that you're optimizing growth hormone or why your growth hormone is high. But just a basic overview, our brain releases growth hormone, and as it travels around the body, it goes to the liver and it produces IGF-1. That is most often what you're going to look for in a blood test, and that is because HGH, human growth hormone, has a very short half-life. IGF-1 is much longer. Now, the other issue is still that your IGF-1 and growth hormone are going to be highest, usually for most people in the first half an hour to an hour of sleep. It's often also elevated after workouts and if you're fasted. So if you'd like to monitor how your growth hormone is responding to your therapy, most often you're going to measure an IGF-1. There's still difficulty and nuances with that, but that's the quick and dirty. Now let's chat about the two different categories that help our body produce more growth hormone. On one side, we have compounds or peptides that hit the growth hormone releasing peptide receptor, aka the ghrelin receptor. Ghrelin, you can think about your stomach growling because ghrelin is the hunger hormone. And like we talked about earlier, whenever you're fasted, your growth hormone goes up. This helps your body regenerate. It also helps optimize its glucose utilization, aka it's going to help you with better energy. And on another spot on the brain, we have the growth hormone releasing hormone receptor. So it can get confusing between the two. We have the growth hormone releasing peptide receptor, growth hormone releasing hormone receptor. On the growth hormone releasing peptide receptor, I would say there are three popular ones. One is going to be the growth hormone releasing peptide, GHRP. There are multiple of them. MK-677, which is actually not a peptide, it's too large of a molecule. And then also Ipamorelin. I would say those are the three most popular. On the growth hormone releasing hormone receptor, I'd say the three most popular are going to be Tesamorelin, Tesamorelin, and CJC-1295. Now, let's break them down. As far as the GHRPs, growth hormone releasing peptide receptors, go, I'd like to talk mostly about MK-677 and Ipamorelin, as those are the two I had the most experience with. MK-677 is what I'm most familiar with, and there is actually a decent amount of research on it. Many of the other GHRPs, there's not a lot of human data, and several trials using MK-677, 25 milligrams nightly. Seeing a 40 to 70% increase in an IGF-1 is not uncommon. Now, IGF-1s for most people are going to come in from somewhere between 100 to 150. Optimized, I see some people naturally a little over 200. So it obviously depends on your starting point. Someone who has an IGF-1 of 150 to 170, it's not uncommon to see them get up to 225 to 250. Whereas someone's down at 100, getting them up to 170, 180. Most people will start at 10 to 12 milligrams and move up to 25 milligrams. The major downside to MK-677 is it does make people hungry. This does hit that ghrelin receptor, which we chatted about earlier. And that's often why I recommend taking it and trying to go straight to sleep, because within a half an hour to an hour, you could get hungry. Now, the other popular growth hormone releasing peptide is Ipamorelin. Ipamorelin seems to be very, very safe. It doesn't have a whole lot of human data on it, though. Most people who are using Ipamorelin are using 200 micrograms a night. This seems to be very well tolerated, but we don't have a whole lot of human data. Many of the studies were done on animals. It did get through a couple of human trials showing safety, but not a whole lot of peer-reviewed data on it. What's nice about Ipamorelin is it's usually very well tolerated and seems to be very safe. Ipamorelin, though, is usually injected compared to MK, which is usually oral. Now, switching over to the growth hormone releasing hormones. Now, these are peptides that hit the receptor, so again, can make things kind of confusing. And we have two popular ones I'd like to chat about, CJC-1295 and Tesamorelin. These are both the newer growth hormone releasing hormones. There's an older one called Tesamorelin. I used Tesamorelin first out of school, didn't have a whole lot of great results with it. Some people still do well. As far as really elevating IGF-1 and having clinical outcomes, I've seen better results with CJC-1295 and with Tesamorelin. CJC-1295 has a decent amount of research. It was stopped, and it was usually used with a compound called DAC. This helps extend the half-life, and people were doing 2 to 4 milligrams. Most of you who are somewhat familiar with CJC-1295 know most people are doing 2 to 300 micrograms. This is done nightly instead of one large injection, which has this compound called DAC, which increases the half-life from minutes to hours, upwards to days to weeks. CJC-1295 with DAC has a half-life up to 6 to 8 days, whereas CJC without DAC can last about 30 minutes to 2 hours. I personally feel more comfortable without the DAC, having a compound that's lasting 6 to 8 days on a half-life, which means that can be up to a month before it's out of your system. It's something I'm less comfortable with, so I stick with using CJC-1295 without DAC. And like I said, because you're doing a once-a-week injection of 2 to 4 milligrams, and people are doing it nightly, they do somewhere between 200 to 300 micrograms. Now, CJC is most popularly stacked with Ipamorelin. And the idea is that using them both together, it's going to work synergistically. And so if you're using a CJC-1295, you can often see a 70 to 100 point jump. Adding the Ipamorelin, you might see another 10, 20, or even 30%. It's really highly individualized, and we don't really have enough data. I can only go by from what I've seen clinically and by what other people have said on the internet. With that being said, Ipamorelin and CJC-1295 are most often the two that are stacked together, and that's probably due to its price point. And with that, then we can talk about Tesamorelin. Tesamorelin is the generic name for an FDA-approved drug called Egrifta, and it's going to have the most data behind it. Because it's FDA approved, it's went through clinical trials, and it's mostly been used in forms of wasting or HIV or people who have poor lipid panels. Egrifta recommends using 1.6 milligrams nightly, and you can often see 100 to 150 point jump. I would say compound for compound, Tesamorelin is going to come out the best. Issue with Tesamorelin is most often the most expensive of all of them. Egrifta can run into the thousands of dollars a month, while Tesamorelin, if you can get it compounded, or people go to the dark web and get it from research purposes only, which I cannot recommend as a doctor, so stay away from those. With that being said, though, Tesamorelin is probably the most popular of the growth hormone increasing compounds. Because of the price, often, again, what people will do is go to smaller amounts, anywhere between 200 micrograms, 500 micrograms, as high as about 1 milligram. Many of these people still see really great results in an increase in their IGF-1, and people will then stack Tesamorelin with Ipamorelin to see an additional 10 to 20% boost. This is another very popular combination. Now, I assume you're probably thinking, Dr. Moeller, why aren't people mixing MK-677 and Tesamorelin together? Well, there are people that have done that. The issue is, I think here is that you have an oral and you have an injectable. And one thing I haven't really chatted about is that with my patients, I recommend to optimize your growth hormone. You really don't want to be eating much before you go to sleep. Now, 2 to 3 hours before bed isn't too much of an issue, but you don't really want to have a very high glycemic index or high carbohydrate meal right before sleep. You don't want to be munching down on a cupcake before you inject your growth hormone peptides or take an MK-677, because once you eat that, your body releases insulin. And insulin and growth hormone, for lack of a better term, are like hitting the gas and the brakes at the same time. Your cell is usually going to prioritize, are we regenerating or are we storing goods? And insulin is, hey, we have all these extra resources. It's time to store things, where growth hormone is more of a cleaning hormone. Hey, we're fasted. We don't have a whole lot going on. Let's clean everything up. So it's really not a great idea to be eating like a bowl of ice cream and then go taking growth hormone peptides and going to sleep. And because of that, often when we're dosing, I usually do something with my patients and recommend doing something like 5 days on, 2 days off. And this is a controversial take, but two things that this does. One, It allows people who want to have a cheat meal. Let's say it's Friday or Saturday night, you're going out to dinner, you're on a date, you're with your loved ones for a birthday party. You go, oh, I can't eat that cake because I'm going to bed in 2 hours and I'm going to go inject myself with the growth hormone peptide. Now, you still could, but in my opinion, you're greatly diminishing the effects of that peptide. So you might as well even skip the injection. And also, what that's doing is resetting the sensitivity of these receptors. Similar to when someone's doing caffeine constantly, having a day or two off, it's going to reset the sensitivity of the receptor to the medication that you're using. Also, slight benefit is it might be a little bit easier on your pocket, aka you're spending less. So basically what you heard about using these peptides is you can often see 50 to 100 point jump, and then estimating putting them together might be 100 to 150 point jump. So how does this compare to actual growth hormone? Well, first caveat I'll say about using actual growth hormone is, as a doctor, you cannot write for this off label. Growth hormone I can only prescribe if someone has dwarfism or an extremely low IGF-1. The DEA is very particular about how you use these controlled substances. If you stub your toe and I think it will help, I can write you for an antibiotic. If you have a headache, I could write you for a blood pressure medication. This is called using these medications off label. And so, for instance, we can use testosterone for low libido. With growth hormone, the government doesn't like us doing that. So it's very difficult for a practitioner to give someone a prescription for growth hormone, as it's not allowed to be used off label. With that being said, someone who actually is able to get their hands on 2 to 3 IUs of growth hormone and they inject it every night, you may see them have an IGF-1 of 250 upwards to 300. Really depends on the individual. So as you can tell, these growth hormone peptides often are not quite as good as HGH. Some people will make the argument that because your natural growth hormone is more pulsatile, that you may have a higher IGF-1 average versus just doing a shot of HGH, but we really don't have any data on that. The other issue with HGH is it's just much more controversial from a health standpoint. I think a lot of people who are popular with it will say 2 to 3 IUs is actually pretty safe and if not therapeutic. Going above that, you can see some things like carpal tunnel, maybe raising blood sugar too much and inducing diabetes. But again, that's a topic for another video. So overall, we broke down how we have our two major classes for increasing our growth hormone, how they've been used together. But ultimately, you need to check in with a healthcare practitioner. This is not medical advice. Many of these compounds are not FDA approved, so make sure you're being safe out there. With that being said, if you have used some of these and you'd like to fill us in on your experience, please leave your comments below. I'd love to hear data. So if you've used some of these and you can tell us the dose and where your IGF-1 came in before and after, I think that would be super helpful and very interesting. And if you found this topic interesting, I think you'd like this other video that I did. Thanks for stopping by. Until next time, stay vigilant, my friends, and God bless.